You don't know what you just did to that socket. You don't know if there's a crack. Here, if I see a crack, I'll stop. Then I'll cut more bone. I'll remove some bone in the palate. Create some space, move the tooth in that space. So there's only two ways. So your beginning of the case is either you're gonna flap first or you're not. Another reason why I like to flap first is because I see the whole architecture. I can measure from the incisal edge. I can draw my pencil lines when I'm thinking I want to put my implants in, right? And I can measure how thick my prosthetics will be at every site. So in that sense, it gives you a great visibility and great landmarks. And you can kind of see, says, you know what, well, if I'm gonna put my implant here, man, I'm gonna need a 17-degree multi-unit, right? Because you're gonna get a sense where everything is. Right off the bat, if I'm gonna put an implant here, now I'm thinking prosthetically. Unless my implant goes in like this, most likely I'm gonna have to use a 17-degree anyway, right? Unless you bring the implant this far palatal. The problem is you bring this implant this far palatal, you're just thinking your prosthetic that much. Patient's tongue space. Do you see how this whole thing's evolving? I have this conversation with the patient in a consultation. I tell them, your speech will change. What do you mean? I said, this is going to be thicker than your natural teeth. Implants going to go where teeth are not, because I gotta, it's like taking the TV off the wall. I gotta find better wood for the stud to put the screws in. The patient's like, I get it. Well, you can't put an implant there, right? Yeah, I can. So I gotta reposition this implant, right? So, and if this bone is not good, I have to bring the implant in this way, so then I gotta use a 70-degree implant. So all this stuff is going through my mind at the time of consultation. I review the case right before surgery again. Or I can come in here and I can make the implant go this way. If this buccal plate breaks, you know what, forget it. I can always, let's just say this whole thing breaks. So what? I'll put the implant here, right? Something like this. The M technique, described by Dr. Oli Jensen, the first oral surgeon for clear choice. Wrote an article on the M technique, where the implants are going towards each other. The Z point, right? The apex of the implants. You're going towards the piriform rim. I'm going to show you guys how to dissect the nasal cavity. I'm going to show you how to dissect around the piriform rim. I'm going to show you dissect around the incisal frame, right? So, and then the mandible, I'm going to show you dissect around the mental. So I have options here. So if this buccal plate breaks, I can go this way, right? And I'm still not really touching my other implant, right? I still have room for 3 implants. So don't ever handcuff yourself. So here, you can kind of see where you can put these implants, right? So you can either choose to come here anterior to put that implant in. You better get it dead on, because you don't want to make the implant come too far facial. Now you're going to thicken the prosthetic. Now the patient will lip support. Now, like, why is that a big deal? Great, patient's wrinkles go away. Go ahead and relax. Swallow. What comes together first? So that's how you can tell, you know, if only back teeth, then you know you bite something is, you know, me, I bite in, I slide in. So already I'm off. I need calibration, I need ortho, I need something. That happens in time of consultation too. That's where that zebra is, that's where that facial Facebook comes in, right? Document that. So if you now take this and you change this, what is our mouth for? Speaking, eating, swallowing, right? So if
you change something after the Facebook registration the first time?
I just want to get a sense how they are.
Just for
unless they have minimal teeth, unless they have no. I want to see how they function. I want to see envelope motion. I want to see their patterns. This is important. Especially even if you do a single. I mean, we forget. They teach us all this stuff. We throw it away. We lost. I don't have time for this. You better articulate. So my point is, you want to. What do? We make this beautiful prosthetics. We put in the mouth. Oh I hit it. You start grinding. Well, if you have the envelope motion, if you know the buccal quarter, you know where everything is ahead of time with this face bow, then design the tooth based on the wear pattern. Don't make it so perfect and now you gotta cut grooves in the tooth.